Hello, everyone. Welcome to our webinar today with BCHC. I'm just going to give a few moments for all the participants to come on and get settled. So I want to first start off and say welcome everyone and thank you for coming today. My name is Alyssa Rorick and I am the age-friendly program lead here at BC Healthy Communities. We are excited to have you here to talk about engaging older adults in communities. Our goal today is to offer strategies to increase attendance in community programs, broaden the diversity of attendees, and highlight the importance of collaboration between local governments and community-based organizations. Next slide. Before we get started, I would like to acknowledge that I work and live on the traditional lands of the Lekwungen-speaking people, which includes the Songhees and Esquimalt First Nations, where we work, live, learn, age, and play. If you would please take a moment to acknowledge in the chat where you're tuning in from, please. So a little bit about BC Healthy Communities. We are a team of public health specialists and community engagement practitioners operating at the intersection of planning and public health. Here at BC Healthy Communities, we believe that it is possible, and not just possible, but necessary to create communities where it is easy for citizens to be healthy and well. And today we aim to provide you ways to strengthen your communities by engaging older adults. Next slide. So just a little bit of housekeeping. Today, our wonderful speakers will do their presentations. We have the Active Aging Society going first, and then Sarah Lee from the City of Surrey speaking second. And that will be followed by a question and answer period at the end of the webinar. So please post your questions in the Q&A box at the bottom of your screen. And also, at the end of this webinar, we will have a survey pop up as you exit Zoom, and the link will be posted in the chat. If you could please just take a few moments at the end of this webinar to complete the survey, we would greatly appreciate it, as your feedback helps us make better webinars for you in the future. And the last bit of housekeeping I have for you is that this webinar will be recorded and you will receive a link and a resource sheet after the webinar is completed. So please feel free to send the link and the resource sheet to anyone that you may think would benefit from this webinar today. Next slide. So I would first like to introduce our speakers and our panelists today. First up, we have three speakers from the Active Aging Society. We have Joni, who is the principal scientist at the Active Research team. She's the executive director of the Active Aging Society and a clinical associate pastor at the Department of Family Practice at the University of British Columbia. We have Krista Hoy, who is the Senior Manager of Programs and Evaluation with the Active Aging Research Team. She works to develop, maintain, and support partnerships with organizations of all shapes and sizes across the province to deliver and evaluate Choose to Move. And then we have Harveen, who is the research coordinator with the Active Aging Research Team. She leads the team's work to adapt, deliver, and evaluate Choose to Move for Punjabi-speaking older adults. And then we have a wonderful speaker from the City of Surrey, Sarah Lee, who has worked for municipal governments with Parks and Recreation and Culture for over 35 years. She has held many roles and is most passionate about the development of relationships within the community. Most recently, she has led the process to update the age-friendly strategy and the action plan and currently coordinates the Surrey Age-Friendly Network. So I would like to pass it over to our first speakers today with Active Aging Society, and they're going to share their slides, and Joni is going to kick us off.
Thanks so much, Alyssa. And as the presentation is just coming up, I want to acknowledge all of the folks who have joined us today from all over. I see we've got folks from Alberta, from Ontario, across BC. So welcome. And I really hope that we can provide you with some of the information that you're looking for. And if not, we're going to have an opportunity in the question and answer period. I know that everybody comes here with something that they're hoping to learn, and certainly hope we can answer questions and provide support. I am in what we commonly call Vancouver, the unceded ancestral territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. While our team is located in Vancouver, we do work across the lands, across British Columbia, and acknowledge the stewards of the land across our province. So we're hoping within the context of our presentation, we want to do a few things today. We want to talk to you about the Active Aging Society signature program called Choose to Move and its main outcomes. We want to generate a list of recruitment ideas for your community. We know that it's really hard to reach some populations. Oftentimes in our programs, we get the same people coming over and over and over again, and we know that there are a whole host of individuals out there who could benefit from the great work that folks are doing across the sector. These are just offerings and learnings and ideas from our team. I would encourage those of you who are on the call to also please post in the chat some of the ideas and strategies that might have worked for you. This is really a community of learning. We're going to talk a little bit about some of the steps you can take to build a referral network in your community. So in our work, it's about working with partners who deliver Choose to Move, but it's also working with a whole host of other partners who refer individuals into the Choose to Move program. And we'll give you a little bit of insight as to how you might get involved with Choose to Move in your community. Mostly, we're going to provide you resources. If you like what you hear, you can follow up with us after. So I've already indicated that at the Active Aging Society, we work with a whole host of partners. Our not-for-profit is a little bit unique in that we work very closely with the Active Aging research team at the University of British Columbia. And I personally wear two hats. You heard in my introduction, I'm principal scientist and executive director. And so what this really means is that our team is really committed to ensuring that we're using the best science or best evidence when we're building and implementing a program. Our signature program, which is funded by the Ministry of Health in the province of British Columbia, is called Choose to Move. It's an evidence-based program, and we've studied Choose to Move to ensure that it's both effective and it's effective at scale. So we've gone through a very rigorous process from looking at it at one pilot location to two pilot locations, then across British Columbia. Our research is funded through Health Research BC and the Canadian Institutes of Health Research. So we couldn't do our work without a whole host of partners. The Active Aging Society is really a conduit and a support system for a whole host of organizations that deliver the Choose to Move program. Here are some of our partners listed on this slide. You're going to hear from one of our dear partners, Sarah Lee, in the second presentation, where we work very closely with the City of Surrey. But you can see that there are a range of NGOs here. We have some partners in the recreation sector like YMCA and BC Parks and Recs, and then a whole host of communities represented. Okay, so what is Choose to Move? We've thrown that around a few times, just a couple of slides. Choose to Move is as I said, evidence-based program, and it's really centered around an activity coach who works with a group of, between 8 and 12 older adults to help get them active and connected. We know that in Canada right now that we're facing two epidemics, an epidemic of inactivity and an epidemic of loneliness. And so Choose to Move has really been designed around those two main outcomes to get people active and connected. And it's all facilitated by an activity coach who meets one-on-one with participants over a series of 3 months. There's a one-on-one consultation, and then there's group meetings, as I said, over that 3-month time period, where a coach takes participants through a range of topics related to getting active and being connected. What I will say is that Choose to Move does not replicate anything else in a community. It is a wraparound program. So, in your one on one consultation with a coach who's very knowledgeable about existing resources in your community, they might identify, for example, that a participant really wants to be involved in a walking program or a Zumba class, and they will connect that individual with pre existing programs in the community and refer them into it. The group meetings, of course, are designed to facilitate social interaction, and also help support goal setting and problem solving. So to date, we've reached over 10,000 older adults across British Columbia. Notably, we've trained over 200 activity coaches in almost 1,000 programs. So as I've already indicated, we have, through our research, our allied research team and support from our external funders, been able to look at the impact of Choose to Move. Choose to Move does show that it increases physical activity, it increases social connectedness, it increases access to community resources, and notably it decreases loneliness. So again, back to those two epidemic problems, loneliness and inactivity, Choose to Move is truly a solution for those issues.
Great. Thanks so much, Joni. Great. So moving on from here, I think just to reiterate some of those concepts from Choose to Move, I think, we have been delivering Choose to Move for close to a decade now, since early 2016. And of course, we have the research where we see the numbers and the outcomes there, but we've been gathering, personal stories from participants over the years as well, right? And we hear some pretty powerful and impactful stories about the impact of Choose to Move on individual participants, like being able to stop medications, being able to stop using a walking or mobility aid, and something as broad and general as wanting to participate in life again, right? So it's we're really pleased to see the impact and hear those stories as we move forward. But really why we're here today, right, is to share some of what we have learned from working with partners since 2016 on how can we better support our partners to bring in participants to Choose to Move, and I'm hoping some of our learnings will be applicable to all of you as well. And certainly as time has gone on, we have diversified what we've been doing and have tried some new strategies. But I think at the end of the day, we all know that it's hard work to bring in diverse populations. But there are some steps we can all take to support that work. So I just wanted to share a few key learnings that we've heard from our partners over the last several years, and then I'll pass it over to Harveen, who will kind of tell you a little bit more about how this comes to life with our adaptation of Choose to Move for Punjabi-speaking populations. And none of these key learnings are really shocking, but the first one, reaching hard to reach populations takes time. So our key tip there is to begin your promotion and recruitment activities several months before your program begins rather than weeks. A big key learning, particularly in a more kind of recreation-based sector, is that for a program like Choose to Move or other programs where you're trying to recruit people who might not normally come into a recreation-based setting, it's likely going to require additional efforts than your traditional program. So, certainly putting information in your program guide and putting up posters around your facility will be helpful, but it's not going to be enough to bring in new clientele or reach some of those new populations. So our communications team has been supporting our partners for the last number of years to really think about where your target populations get information about programs. And so this slide here kind of gives you a little bit of a list of things to think about, when you're doing promotion and recruitment, how might you do things a little bit differently than a traditional program? So think about where that population gets information. We've bolded here, newspaper, TV, radio, and a referral network as things that have been particularly effective for our work with Choose to Move. But again, thinking about, if you're trying to recruit men in particular, right? Like where are men going, and who do they speak with, right? So whether it's service clubs, the Legion, barbershop, and think about some of the other things that are happening within your community. And so kind of piggybacking on that is to identify and promote both to potential participants as well as referrers. So great to promote directly to folks who you want to be coming to your program, but also powerful to share information with individuals who are in touch with that target population. So here too, we think about, it can be really helpful to generate a list of potential referral partners. So for Choose to Move, we have seen things like physiotherapists, pharmacists being really, really helpful. If there's a past participant who's, particularly outgoing and, has a large network within their community, how can you leverage them to support some of your promotion and recruitment activities? Again, for Choose to Move, of course, we're trying to recruit folks who aren't already active and we're maybe a little bit isolated, right? So where are they going and who's in touch with them? So, when we see a community do a really good job with promotion and recruitment, they're doing employing a number of different strategies. So they're, including social media to reach possibly family members of their target population. And so this next one, so media coverage is powerful. And this, we've seen time and time again that when we're able to get media coverage for Choose to Move, it really does a wonder to help fill programs up quite quickly. And so here's just a couple of images of media coverage that we've had in the last few years. An article here in the Prince George newspaper, and that was the activity coach, so the leader of the program, who was interviewed by the local paper. Same here on the left image, we had one of our activity coaches during the pandemic interviewed by Gloria Makarenko on CBC, talking about our virtual program offerings. So really identifying a champion to be a spokesperson for your program and helping them to develop some skills in speaking to the media can be hugely powerful. Next one is really to consider the program location. So, we know that, especially for Choose to Move, right, the people that we are trying to recruit might not necessarily be comfortable coming to a recreation-based facility. So some of our partners have had a really great success in offering their programs in different types of locations. Our partners on Gabriela Island offered one of their programs in the church. And then one of our partners on Vancouver Island offered the program through a retirement residence. We know that lots of libraries have community spaces, and that might be a good space as well. So just really want you to think about where your target population might be more comfortable coming to a program. And last but not least here for my section, again, not shocking, but this work takes time, and having a plan for how you're going to approach your recruitment and promotion is hugely helpful. Making sure you have enough time, use your kind of traditional and non-traditional recruitment methods, engage that referral network. And the other thing too is, certainly with Choose to Move and many other programs, they're offered kind of on a seasonal basis, right? And so thinking about how, each time your program is offered, if you need to tweak that promotion and recruitment plan, so consider things like seasonality, and timing, right? Like we're really encouraging a lot of our partners right now to, get out and get have your activity coach spend some time at the craft fair, right? Or, and in the summertime, we know that, lots of people are away and not available. So maybe that's not the best time to be offering programs. But yeah, just really think about what, how the time of year might impact your recruitment plan, and things that worked one time might not work the next time. So just try to consistently be revising and updating that plan. But I will pass it over to Harvey now to talk more and really bring this to life for you in what we've been doing in partnership with communities to deliver Choose to Move in Punjabi.
Thanks, Krista. Hello, everyone. I'll be sharing some of the strategies and techniques that we use to ensure that this program, Choose to Move, was culturally relevant, engaging, and impactful for the Punjabi older adults. So going on to branding, we will speak about like the logo. It's still Choose to Move. We wanted to really build that message, and those components will remain, but we also wanted it to be approachable for our community. So it's Choose to Move, Aao Changi Sehat Wal Chaliye, which means come, let's move towards better health. So for us, in order to do the work we were doing, we've done numerous community consultations. So with this approach, it's not only best practice, but it's also an innovative way to reach a variety of older adults across different backgrounds and demographics. When we take the time to listen, collaborate, and co-create with our communities, we're ensuring that our programs are going to have a meaningful, culturally relevant, and everlasting impact on the community. So let's understand how these community consultations transform the program into the tools for real positive change. So as you can see, they were ensuring that cultural relevance and appropriateness piece when we were adapting our program for the Punjabi-speaking older adults. So with these consultations, we were provided firsthand insights into cultural norms, practices, and values of the population. They also helped us identify potential barriers or misconceptions or sensitivities that may arise. And adapting these programs with cultural input from the community members enhances that inclusivity and acceptance of the program, and also acceptance of you as an organization. We also focused on that strengthening those relationships and building that trust. So strong connections and relationships contribute to higher engagement and program sustainability. So involving the community into program development fosters that trust and that mutual respect. The community members also feel like they're valued and their voices are being valued and heard. And addressing those unique and needs and identifying those gaps, right? To promote equitable access and outcomes, we can avoid the assumption or that notion of that one size fits all, that Choose to Move just works for everyone. We understand we had to make some modifications and adaptations for this population. So with these consultations, we were able to uncover any challenges or barriers or any specific needs that this population had. So with these consultations, we were also able to ensure that our program was being adapted in a way that was going to best serve the older adults in our community. So we started off thinking South Asian older adults. Quickly learned that South Asia is very broad and we need to focus in a bit more to the Punjabi-speaking population. So with that, we focused on building that trust with those organizations and with those community organizations, which later then translated into building into partnerships, which led into these organizations signing on as our delivery partners. So it worked out great. Next on this, we're going to be speaking about the promotion and recruitment activities and efforts we did for the Punjabi Choose to Move program. So reaching the right audience. So effective promotion ensures that the program's going to reach those who will benefit the most. So when you're creating those promotional materials, tailor them to the people that you're hoping to reach, right? This might be through imagery, this might be through texts or catchphrases, so keep those in mind. And also things like visual preferences, that comes into color, that comes into shapes and sizes of when you're creating those promotional materials. This is key. So we designed those promotional materials that had carefully chosen images that conveyed the essence of the program. And we also tried to avoid that overcrowding with text, because our goal was to ensure that the visuals were going to resonate with the population, and it was going to draw like that immediate interest for any potential participants. We also recognize that there's these varying levels of English and Punjabi literacy within the community. Just because someone could speak English did not necessarily mean they could read and write. And same with Punjabi, just because someone's native language was Punjabi, we should not assume that they could also read and write Punjabi. So that's also where that focus on imagery was a bit greater, because we were trying to, again, avoid that one size fits all. But then we also did create social media posts and posters, because if the older adults weren't reading them, maybe their children were, maybe their grandchildren were. So we were also broadening our reach to draw in that right audience, reaching that right audience. And then when we're doing all that, we want to also be the face of our program. So for you all too, when you're creating your programs, be that friendly, reliable, trusting face of your organization. And this is going to allow you to build that credibility and that presence in that community. Engaging directly with your community is also going to allow you to share your program's purpose, values, and services. No kind of middle person, no misinterpretation. So I would also ask you to reflect, who is the face of your programs? You know, is it a coordinator? Is it a facilitator? Is it the manager? Is it a champion? Is it a previous participant of a program that is the face of your program? It's very important to have those. So for instance, when we become the face of our program, when we become the face of our programs, we actually hosted booths and exhibitor tables at events such as the Seniors Resource Fair hosted by PICS or the South Asian Dementia Forum hosted by ICON. We also then actively participate in those community gatherings, which ensure that potential participants, along with delivery partners, are kind of seeing and hearing from us, and we're kind of constantly always there. Moving on, we're going to speak about utilizing your referral networks that Krista was mentioning. This is super, super important. Collaborate with your community. So this might be within your community centers. This might be religious institutions. This might be cultural organizations to spread that word about your program. Using community events was one way that I mentioned, you know, kind of being the face of it. That could be a referral network as well, but also using like things like newsletters, social media groups to increase, again, that visibility and encourage engagement. These kind of can also include, you can just be taking part in community events or holidays or festivals happening, you know, where you're, again, allowed to be a part of your community. When we were promoting Choose to Move in Punjabi, our team actually participated in numerous events such as the South Asian Dementia Forum and also the Summit on Aging to, again, bring awareness and hopefully increase reach of like our participant base. So these opportunities reinforced us to remain connected with our service providers, referral and delivery partners, but also connect with older adults. Additionally to this, we did some support with recruitment as we established a partnership with the Sikh Society at Ross Street Gurdwara. So many Punjabi speaking people do belong to the Sikh faith. So we understood that they feel safe and are present in Sunday service, for example. So when we partnered up with Ross Street Gurdwara, we were able to conduct an in-person meet and greet for promotion with our older adults on our regular Sunday service. And this is because the community members are feeling trusted, they felt like their space was culturally relevant, and it just allowed for greater reach. Lastly, I want to talk about local media playing essential roles in reaching specific populations, the way Krista mentioned. So by using platforms that are familiar and trusted by the target audience, we can ensure that our messages resonate and inspire action. So for example, I actually had the opportunity to speak on Red FM, which is a leading South Asian radio station. And during the segment, I had the opportunity to speak directly to listeners about Choose to Move and emphasizing its relevance and benefits for the community. And finally, I want to speak about tailoring our messages to address specific needs and benefits. So customizing, again, that promotional material, but also your program material, as it's going to reflect unique cultural, practical needs for your population. So for us, we also understood you couldn't just pump in English sentences straight into a Google Translate or any app translation app. We had to actually because it would be too literal and it was going to be maybe overly formal, and which our target audience wouldn't have even understood. So what we had to do is when we were translating, we had to make sure that the sentencing and the message was culturally appropriate and also relevant. So when we were creating, for example, the welcome and goal setting slides, underneath it, it doesn't actually translate literally welcome and goal setting. It says, "Aao teacher banaiye," meaning let's make some goals. And with that sentence, it almost carries the tone and the essence of the word welcome without really having it in there. So it might be a small thing, but these type of things make a really big impact when you're working with those diverse populations. And in our messaging specifically, we emphasize that Choose to Move is a health promotion program. It's designed to offer participants with the opportunity to learn, but also to engage with their peers. We do speak about how they will be engaging in different health topics, but we're also really focusing on that peer engagement. So the message is crystal clear, and they're not really left out guessing what they're kind of joining. So these are kind of just a few of the things that we did to adapt our Punjabi version of Choose to Move, and I hope that was helpful. I'm going to pass it back on to Krista.
Perfect. Thanks so much, Harveen. And thanks, folks, for the comments in the chat. Certainly, yeah, we know that there are places in the province that we have yet to reach. We do offer Choose to Move virtually as well, so that's been a great option for folks in locations where there isn't an in-person option for Choose to Move. But if you are interested in please visit our website at theactiveagingsociety.org/become a partner. And there we have an expression of interest form. And we're especially looking to hear from you if you serve culturally diverse seniors, older men, seniors in rural and remote locations, especially in the north. And I saw someone put down there, you know, the northern part of Vancouver Island. Certainly, yeah, that's been a gap for us there as well. And if you serve low income or marginalized seniors, we're particularly interested in hearing from you. But we also encourage you to refer your clients into existing programs. We have referral resources available. You know, we have a mailing list where we send around information about upcoming programs ahead of kind of each cycle beginning. And we also have, you know, posters, rack cards, those kinds of resources available to you to share information about the program. If you're interested in finding out, you know, is Choose to Move in my community, encourage you to visit the Choose to Move website locations page there. And this is, especially this time of year, we're getting information pretty fast and furious for programs that will be upcoming in the new year. So please do take a look at that to see what's happening in your community. And like I said, we have promotional materials available that we are happy to share with you if you'd like to distribute them in your community. So just get in touch with us. We also have a Facebook page. So just search Choose to Move in Facebook and encourage you to follow us there and share our posts. And that is it for us. So thanks so much, and we'll have an opportunity to do some Q&A after Sarah Lee's presentation. So thanks so much.
Awesome. Well, thank you everybody who just spoke from the Active Aging Society. I do see that there are questions being asked in the chat, which is wonderful. Please keep asking them, but also please make sure you put them in the Q&A box. And that will give Joni and everybody from Active Aging Society and Sarah Lee, when she has done her presentation, some time and an option for her to respond. So please keep asking questions. Thank you so much for attending. And now I'm going to turn it over to Sarah Lee from the City of Surrey to talk about the importance of collaborations in enhancing communities. So Sarah Lee, please take it away.
Great. Thank you, Alyssa. Hello, everyone. Joni, Krista, and Harveen are a really hard act to follow. They do incredible work with Choose to Move. So it's a pleasure to be online with the team. So someone's turning my slides for me. I think the next slide would be Great, please, thank you. So I just want to, I know we've done an acknowledgement, as it acknowledged in the beginning, but I'm located in a different place in British Columbia, in Surrey, and we recognize and are grateful that we're situated on the traditional ancestral territories of the Salish peoples, including the Kiatsi, Kwantlen, and Semiahmoo land-based nations. And the city recognizes the importance of honoring the indigenous heritage of this land. Thank you. So brief outline. I'm going to just take a few moments to quickly review our community profile, overview of our Surrey Age-Friendly Network, because they are crucial to the work that we do, brief overview of age-friendly strategy and our updated, and our action plan that supports the strategy, and then some actions and implementation, some examples of what we've been doing and what we are doing. So our community profile, and of course, as soon as we look at our census, it's from 2021, so we're already a few years behind. But just to give a bit of an overview of our seniors, and we go by age 55 plus within our Parks, Recreation and Culture. 55 plus are, that's sort of the age that they can purchase the seniors membership in our recreation services. So we follow the 55 plus. And we're looking at about 28% of our total population that are 55 and older, and it's continuing to grow. And we're this is good. This is giving us a little bit of an overview of how we need to pay attention to this when we're doing our planning. Next slide, please. Our Surrey Age-Friendly Network. This network consists of a wide range of organizations, nonprofits, specifically our community-based sector, including our settlement services. We have our Choose to Move as one of our age-friendly network participants. TransLink, we have Fraser Health, Division of Family Practice, we have academia, and as well as some of our faith-based groups, and also some of our representation of our internal, such as our Surrey libraries and some of our city staff that work on transportation, housing, etc. So the role of the Age-Friendly Network is to connect individuals, service agencies, organizations working with seniors, older adults, and elders, and to help support and carry out initiatives that support the goals of the strategy, and also to share information about various programs and services for seniors, caregivers, and families in the city of Surrey. Next slide, please. Thank you. Age-friendly strategies. So this is our second iteration of our age-friendly strategy. It was originally developed and adopted by Council in May 2014. So we've just recently updated it. We stayed with our same framework, which you see on the slides: safety, health and wellness, transportation, mobility, home and buildings and outdoor spaces. It was a solid framework that we had went through the process originally with our age-friendly strategy, and this one was recently adopted in January of this year. So we're very excited about that. And so these four key outcomes, that's the basis of our sort of a framework that also will roll into our age-friendly, or rolls into our age-friendly action plan. So our age-friendly action plan, I just want to acknowledge that BC Healthy Communities provided funding for the development of our age-friendly action plan, and it is now a public document. It is available on our website, as well as our strategy. And this action plan, we're very excited about this because this puts a lot of accountability, because it's a public document. And so it was very exciting to be able to work on this project. And it also builds on our age-friendly strategy and foundation. It aligns with all of our other city strategies and plans, and using, of course, best practices, collaborating within our city departments, community groups, and organizations. And I want to highlight too that these documents, a huge part of the development of the documents was through our age-friendly network. So our priorities, our foundational priorities for our action plan is around equitable communication. And you've heard some examples of how Choose to Move and how Harveen and the team have been, the importance around communication and knowing your audience. And so using various channels to inform public about the services and the programs, advocacy and collaboration, Indigenous community engagement. And we do have a lot of work to do there, and we are very committed to that. Partnership building, again, other examples around our age-friendly network, a lot of collective work being done through the partnerships. I just want to highlight the photo there. This is an example of our collaborations. Some of these photos just reflect some of the work that's been happening around this. Next slide, please. So referring to our actions, so this is sort of a little bit of a high level of our actions. And again, going back to the four key, the framework that I noted earlier, we want to make sure that we increase the participation of older adults in city and community-based groups and programs and services. Now, yes, I am a city employee, and yes, we do promote our city services, our parks, recreation, and culture programs and services and events. However, there are programs and services that our community-based sector are offering, and I think it's an important part where we do work together to make sure that the programs and services are available for our seniors and older adults and elders. Work with the Division of Family Practice and Fraser Health to facilitate information flow about primary health care and access to city wellness programs. And this is huge. Through our process of updating our strategy and our action plan, we heard loud and clear, and this is no news to anyone who works with older adults, that the medical is just such an important piece. Through our surveys, through focus groups, through individual conversations, it was always the medical that came to the top of the priority list for our older adults. So we've been doing a lot of work with Division of Family Practice and Fraser Health to facilitate this and help navigate. Next slide, please. We want to provide learning opportunities for older adults to navigate digital information and resources and to connect with city services and programs and increase awareness for city's emergency program. And I'll give some examples of these a little bit further on in the presentation. Want to continue to develop and strengthen the age-friendly network in building collective capacity to support older adults through our collaborations and our partnerships. Next slide, please. And transportation mobility. So we want to increase opportunities for learning and navigating the available transportation choices. Next one, please. And home. So we want to facilitate opportunities for older adults to participate in discussions related to housing needs and provide diverse opportunities for education and awareness about information on the continuum of housing supports and services. And you'll see in this photo, here are some of our volunteer ambassadors helping somebody who needs some assistance with, I think it was with Safer at that point they were discussing, but just a little example of what we're doing there. So the next slide, please. And buildings and outdoor spaces. So we want to promote the best practices that support social connections and gathering for older adults. Now, our action plan, of course, focuses, our target is our older adults. However, the City of Surrey, we do a lot of this work anyway in our plans and strategies, but this focus is more taken into consideration places where older adults want to make those social connections and gather together in the community, and how can we make sure that that is a place where older adults feel comfortable to access. Next slide, please. So some implementation examples, and I want to just really stress that these are just a very, very small snippet of what the City of Surrey does to support healthy active aging. Of course, through our recreation services and our parks and our arts and culture and heritage, there is a wide range of programs and services that are offered, wide range of community partners and collaborations between all of our departments as well. So I'm just going to give you a little bit of a snippet of how some of these initiatives are supporting the work, the action plan and the strategy. So next slide, please. So forums. Since 2008, seems like a long time ago now, we have been offering forums. At the time, they were called Focus on Senior Forums. And the intent of those was around the prevention awareness of elder abuse. And these forums have been successful over the years. We've continued them. They're free. And they've evolved into other topics that support transportation, housing, safety, health, and wellness. So just a few topics I've listed on the screen. And of course, there's many more topics that we do offer for the forums. And you'll see a couple of our age-friendly volunteers there that welcome the participants. So they're very involved in the event. Next slide, please. Our forums are offered in English, Punjabi, Arabic, Korean, and Mandarin, and we're always open to other languages. Again, I'm going to refer back to our age-friendly network. We work with our settlement services and our community-based sector to make these happen. These would not happen without the collaboration, the partnership of our community-based sector And they do an incredible job, and we work collaboratively. I take, sort of, they tell me they're the experts in working with various community groups and individuals, and so they've been very successful over the years, and we will continue. We are actually in partnership with Alzheimer's Society for coming up this February. We'll be offering a forum collectively on brain health, and that will be in for the South Asian community. So always open to new languages, new opportunities to host these forums. The forums are free for our older adults and caregivers. Families are all are welcome. You can see there on the screen, we do a fitness break, and we have a lot of community resources, and that's where the networking happens. And as my colleagues here online with Choose to Move have noted, they're part of these types of events as well. So it's a great networking for people. We also offer, the free food and all of the good things that people enjoy at events. And, over the years, we have having people on site that are professionals within the medical health field, and our police services and fire services, et cetera. We've had experiences where the seniors have reached out to those resources. Maybe they're experiencing a situation where they need supports or help. So they've been very, very successful, and we'll continue those. Next slide, please. So the Try It Sports and Games. So this is an initiative that we've worked with some of our community sports groups, connecting with our seniors and the volunteers that deliver these sports and games. And it does aim to connect our community and engage older adults in sport, promote physical activity, and of course, maintaining our mobility, social and health benefits. And it also is one of those initiatives that really will be leading up to the City of Surrey is hosting the BC 55 Plus Games in 2027. So it's just one of our ways of engaging seniors who maybe have never been involved with sports and games before. And we've had several people who have participated in some of our try-its and are now engaging in activities that they were never participating in before and had never had the confidence to come out and participate. So we're seeing a lot of success with these, and they're free, of course. Yeah. Next slide, please. Our digital technology hub, this is available for accessing on our website. It was developed in consultation with our seniors, and our age-friendly network, and it focuses on these key points that you see on the screen: devices, internet access, online activities, tech support, training, and virtual healthcare. We also were very successful in receiving a grant to implement some digital technology forums. And they, again, similar model to the forums I had just noted, but the focus was on digital technology. And given what we heard from our seniors around the medical interest, we have had a lot of support through our Fraser Health and ICON and some of our other colleagues around helping seniors to navigate the digital services online. And we had Life Labs out and a variety of other people to help seniors to navigate these kinds of services and programs. Next one, please. Walk It. This is an activity that was implemented through SISIP, which was our Surrey Intercultural Senior Social Inclusion Partnership Network. It was a pan-Canadian grant that six organizations were involved. PICS was the backbone for this project. A variety of different projects came from that, and one of them was the Walk It. And this Walk It activity continues. We don't have the grant, and the grant is completed, but we do continue with the Walk It activity. It's a weekly program that engages seniors to be more mobile, active in their communities, supporting their social connections. The timing with this, we implemented this after sort of around the 2021, when we were allowed to now go out and start connecting with people, and a lot of people were just craving that connection with others. And so the timing of the Walk It, we implemented it when people were starting to come back out and get socially connected. It's been incredibly popular. We offer it in Punjabi, as well as transit training to help teach the transition to transit training. If people want to learn about how to take the bus, SkyTrain, et cetera, we work with TransLink. They provide that, and some theme events. And also we are working with our Choose to Move colleagues online here, engaging the Choose to Move participants into Walk It activities. So there's a lot of pieces to this. It's been incredibly successful. And the fellow on the picture here, John, was just recently retired. He it's one of those stories which I'm sure all of you have experienced, where he's been isolated, he's just retired, doesn't know what to do, was feeling a bit lost, just very unsettled for him. He heard about Walk It, he's joined Walk It, and his life has never been the same. He said it's just incredible. He's connected, made friends, and continues to be a very active participant in Walk It. So as you all know, you all have these feel-good stories, so I just wanted to share that. Next slide, please. And the intergenerational connections. Again, this is not possible without working with our collaborators. It's an opportunity for generations to engage in dialogue, explore differences, similarities between youth and seniors. And we've been able to offer a variety of different activities throughout different recreation facilities and locations to really promote those intergenerational connections and the discussions around aging and what that looks like. And they've been able to talk about, the young ones have been able to talk about, I want to go into this career, and the seniors are talking about, well, I did this. And so it's really bringing youth and seniors together, and it's been quite successful. Next slide, please. So this is newly implemented, our age-friendly community ambassadors. So this is Enid and Cindy, and the volunteer ambassadors, they go through a training around age-friendly and what it means to be age-friendly. So we've got a training package that they're involved with. We've been able to train about 7 of our volunteers. And it's around a holistic kind of approach. So not just about the recreation services that are available. Yes, they talk about our parks, recreation, and culture services, but they also talk about the community-based sector and the programs and the services that are available to the seniors and caregivers and the families. So, people have been helped to fill out safer forms. And so it's just learning about transportation and how to access various programs and services. So this program has been very successful, and the ambassadors are reaching quite a lot of our community members. And again, this supports that engagement and connecting to the community and making sure that we're doing everything we can to assist our community to access services and programs. And next slide, please. Another example, this was just implemented, and it's so I don't have any data on how it's doing at this point, but we've just firmed with Division of Family Practice, Rala Community Services, and Surrey Libraries that they have these senior passes, the 3 free drop-ins to engage seniors to come out and try some of our recreational activities. And we were really pleased that that Division of Family Practice, because this means that they're able to access the doctors that are able to hand out these passes and hopefully engage some of the seniors that may not have participated in our services or programs before to come out and try it out and pop into a recreation facility at no cost to participate in a drop-in program. So we're really excited about that and hoping that that will engage and provide another opportunity for seniors to get involved in our activities. Next slide, please. And just a quick where to find information. That's the Surrey Emergency Preparedness Guide we developed this year. And I think a few other municipalities, like I know Maple Ridge and United Way British Columbia, developed one specifically for older adults as well. And many of you online may have already developed yours as well. So it definitely simplifies for our older adults, the core information that they need to know. So we did 2 batches of printing copies. So they went like hotcakes. They're very popular. And people are just craving to have this information. And so this was a really good document to have on hand. And then our Healthy Active Aging Guide is sort of a one-stop shop document. It can be found online. We also have hard copies that we distribute. And it's sort of at the back, it's got all of the resources, sort of a one-stop listing of information where people can refer to at any time if they would prefer to look at a hard copy instead of an online copy. And so that's available as well. And that's next slide, please. And that's it. Thank you.
Well, thank you so much, Sarah Lee, for showing the wonderful work that you're doing in Surrey and all of your wonderful programs and how you reach seniors in your community. So now we're going to go into a question and answer period. Please, now that you've seen both presentations, please write any questions in the question and answer box at the bottom of your screen. We have a few minutes here to go through them. We do already have some questions in here, and I see Joni and Krista and some of the speakers from the Active Aging Society have been answering them, but I do just want to highlight them quickly in case one, people have the same question and would like to hear the answer, but then also in case someone didn't see the response. So my first question is for the Choose to Move crew. Is there a grant for Choose to Move? If anyone would like to speak on, I know you answered it, but just like quickly, you can just add a little quick note to that. Yeah.
We have an expression of interest form on our website. One thing I will say is that we work very closely with organizations. So why it's not just a grant application form and it's an expression of interest, you express your interest and then we will work with you to develop that proposal, because we know every community and every organization is unique. And so it's not just a one size cookie cutter approach.
Mm-hmm. Awesome. Thank you. The next question that we have for the Choose to Move team is a question from Sandy, and I want to make sure that she hears your answer. I have run Choose to Move 3 separate times now, and from being in a very small village of McBride, I feel very difficult to find new people. Why can I not have taken Choose to Move in the last 2 years?
Yeah, and I did respond in the chat. And what I will say is for Sandy to reach out to us, because we will problem solve with any of our partners, any particular challenges. That 2-year requirement was put in place to give folks in a community the opportunity who hadn't participated to participate. And also with the intent of getting people active and connected. If somebody's already active and connected, then maybe, it's maybe we can give somebody else that spot, but if there isn't a deluge, we can certainly look at revisiting. I think what you're hearing from me in response to both questions is that the one thing about Choose to Move that I think has made it so effective and why we've been able to reach so many organizations and people is because we are adaptable and we do work to support other organizations as a society. That is really our role and goal, is to support organizations in the delivery of Choose to Move. So we do tailor.
Awesome. That's great to hear. Thank you, especially for those rural and remote communities. It's a large need. Thank you. So our next question is, I think, a really cool one for discussion. I saw that you also answered, Joni, and then maybe this can spark people to say anything in the chat. But in Comox, the question is, in Comox, we are actively engaged in finding and creating intergenerational activities for seniors and young children. We have lots of ideas and are building a pool of senior volunteers. As you probably guessed, there are mostly women. How do we reach men and get them involved as well? All ideas are welcome. Would you like to share your response, Joni, quickly? And then we'll see if anyone else has any ideas.
You know what? I've done enough talking. Maybe I'll bounce it to Sarah Lee, and then if folks want to read my answer.
Perfect. I can read your answer too. But Sarah Lee, if you would like to take this question on some ways, maybe how you engage the older adult men.
Well, the first thing that pops to mind is Men's Sheds, which is a program that many online might be familiar with. That's something that's available throughout various communities, actually not only British Columbia, but across, it's sort of international. So that they've been very good at engaging men in activities. And I think you said something about intergenerational, Alyssa. I'm sorry, was the question around intergenerational with men?
Yeah, well, it says we are actively engaged in finding and creating intergenerational activities for seniors and young children.
Right.
We have lots of ideas. Yeah.
Yeah. And, it's interesting. I think it's just, I think it's finding out sort of what the men are interested in. And I think, it's definitely different than the women, but I think the Men's Sheds would be a really interesting place to start. And also when we're looking at the various cultural groups, with some of our leaders in the community, a lot of them are men with various, involved, like I'm thinking of our South Asian groups where the men gather to engage in activities. So I think it's important to speak with the leaders of those groups as well, if you're looking at some kind of intergenerational, multicultural kind of activity. Not sure.
Awesome. Thank you for your insight. I think Joni had the same response of like, go where the men are. So looking at programs that may not be specifically purposed for or like designed for men, but like maybe that's where they are gravitating towards, or seeing where they are to go reach that type of demographic, for sure. If anyone has any ideas or any other questions too, please, you can put anything in the chat. The last question is another choose to move question, unless we have any other ones, because we are coming up to the end of our time, but I want to address this one before we close up, is can city parks and recreation departments apply for choose to move program, or just nonprofit and charitable status organizations?
Yes, they can.
Okay.
Yeah, we partner with a number of municipalities.
Mm-hmm. Great, that's wonderful to hear. So that, unless there's any other questions, that concludes our webinar for today. Thank you everybody everybody from the Active Aging Society and Sarah Lee for coming to speak. I hope that all the participants gained something from all the information that we heard and learned about the Choose to Move, and learned about new some age-friendly stuff from Sarah Lee's action plan as well. If you would please just take a couple moments of your time to fill out our survey, BCHC would greatly appreciate it, and it helps us create better webinars for you in the 2025. So thank you everybody for coming today, and we hope you have a wonderful day.